Hi everybody, thank you so much for taking the time to watch this video update pertaining to opioid overdose prevention efforts here in Ulster County, but specific to New Paltz, as illustrated in some recent data that I received through the Ulster County Department of Health. The Department of Health gets data from the Ulster County Medical Examiner's Office as well as the Ulster County Sheriff's Department. The Sheriff's Department receives reports from all of the local police departments whenever they respond to an emergency call related to an overdose. So the Sheriff's Department is collecting data on both fatal and non-fatal overdoses here in the county by zip code. The medical examiner's data is also by zip code, and it is a way of identifying the number of deaths that occur in that zip code pertaining to an opioid overdose. It does not reflect the impact and the loss a community may be feeling as a result of family members and friends who we have lost, who died, who may reside in the community but died outside of the community. Okay, so it's really important that that clarification be made. I also would like to, state that we use these data points to keep track of emerging trends, to look at how are we doing in regards to the different strategies that we are employing as a way to prevent tragedies here in New Paltz. So we're going to be moving into some slides that have been created for you. The slides will show a brief historical perspective as far as Ulster County and New Paltz fatalities that have occurred, going back as far as 2014 on the countywide level. We weren't collecting municipality-specific data at that time, but you will see from 2018 to present day how we are doing here in New Paltz. And again, that's specific to deaths that have occurred here by medical examiner report. All right. We'll also then show a couple of slides pertaining to the efforts of the Opioid Overdose Prevention and Response Team here in New Paltz, and that will conclude this video update. So without further ado, we're going to move into the slides. Okay, everyone, as promised, we're going to now move into the slide portion of this video update regarding opioid overdose prevention efforts here in New Paltz and the local data that we have received recently. Before we move into the data, I really want to stress that the members of the New Paltz Opioid Overdose Prevention and Response Team, as well as the partners that I have the privilege to work with, we remain vigilant. We recognize this is not a time for complacency. We know that things can change very dramatically and unexpectedly. So we continue to check in with our people who are emergency responders, service providers, to look for emerging trends, things that we need to be on the lookout for. Do we need to adjust our strategies? And we continue to work closely with our local team members, our county partners, and our Mid-Hudson regional team members. This first slide is a kind of a historical snapshot of the data provided through the medical examiner's office going back to 2014 that I mentioned earlier. At that time, we were dealing with a very different crisis. The opioid related deaths at that time were predominantly from prescription pain medication. And then over time, you started to see the change over from prescription medication, which was becoming really expensive and harder to come by, to heroin. And so our death rate started to go up as a result of heroin being utilized. And then fentanyl started to make its way into Ulster County. And when that happened, our death rates again continued to increase at a very distressing rate. In 2018, it had gone from 14 deaths in 2014 to 56 in 2018. A county task force was organized through the Ulster County Executive's Office and the Ulster County Department of Health. Many organizations of which that represented different sectors of the community began to strategize and look at how we could utilize best practices at that time, because the opioid overdose crisis and epidemic was evolving faster than we could keep up with in regards to researching and evaluating practices in a response. The drug naloxone really became that game changer moment. And we started to utilize naloxone, the trade name of the drug that we have available to us in our kits is Narcan. So you will hear me kind of flip between naloxone and Narcan. I'm talking about the same medication. But we started to do Narcan training in great numbers starting in 2017, 18. We increased those numbers. And we saw our numbers come down in 2019, and we were optimistic that we were really making some good progress in reducing the risks. However, in 2020, the COVID-19 pandemic hit, and with people being in isolation, and now we had a pandemic and an epidemic happening at the same time. And our opioid overdose deaths were just alarming. And we continued to work on strategies and implement as many as we possibly could, getting as creative as we could to meet the local needs and conditions that we were working with. You'll see that our numbers are finally coming down. And this isn't just reflected here in the county and in New Paltz, but it is happening nationally. We'll get there. Just so you understand kind of what we were looking at on from a regional standpoint, regional being our county is divided into three areas: the north, the west, and central and southern Ulster. City of Kingston is its own geographic, area as far as locality. And you'll see New Paltz depicted here in this bar graph for central and southern Ulster, which is comprised of approximately 8 communities. New Paltz is in the yellow. In the middle here, you will see. In 2018, we lost 3 individuals. In 2019, when we had that drop, right, from 56 to 33, we had 0 fatalities that occurred in New Paltz. I so want to see 0 again. We are working towards that effort. In 2020, we went up to 2. In 2021, it was a devastating year. And we lost 4 individuals in New Paltz. And then, as I mentioned earlier, we lost friends and family outside of New Paltz zip code, but who resided here. It was really just such a devastating time. What the data is starting to show is that there is a decrease in opioid overdose deaths happening nationally, as well as in the state, the county, and in New Paltz. When we look at the national numbers, that number has decreased by 17%. But when you look at Ulster County, we've had as far as countywide aggregate data, we've had a 42% decrease of opioid overdose deaths here in Ulster County. In New Paltz, specific to our 12561 zip code, we have had a 75% decrease since 2022. When you look at the non-fatal opioid overdose rate, and again, these numbers are coming from the Ulster County Sheriff's Department. They are documenting, right, the reports they receive from all of the local police departments. New Paltz has also seen a 66% decrease in non-fatal opioid overdoses. Ulster County as a whole, aggregate-wise, that is a 32% decrease. So when we look at the total number of overdoses in 2022, that number was 44 with 2 fatalities. In 2023, that number came down to 34 with 1 fatality. And in 2024, we had 15 total overdoses with 1 fatality. But as I mentioned, our team remains vigilant, and our opioid overdose prevention efforts continue here in New Paltz. The New Paltz Opioid Overdose Prevention and Response Team has provided free naloxone or Narcan training and kits to more than 3,000 people in and around New Paltz since 2020. We do that in a number of ways. Our in-person trainings, our web-based trainings at opioidpreventionnp.org, which is the comprehensive bilingual opioid overdose prevention website that is managed and monitored through the Office for Community Wellness, and it serves New Paltz, Ulster County, and the Mid-Hudson region. And lastly, our outdoor emergency stations. So this would not have been possible without the generous support and ingenuity of the Bruderhof community, who we worked closely with to design, build, and then the town of New Paltz, we installed 9 units in the village in New Paltz, the village and town of New Paltz, that are monitored by the New Paltz Police Department and the Office for Community Wellness, assists as needed for the provision of emergency outdoor naloxone. We also have 16 indoor locations at a number of different establishments, as well as some town building locations where there are AED units. And again, this is a team effort. New Paltz Police Department, New Paltz Rescue Squad, the town of New Paltz's Office for Community Wellness, as well as all of these different providers that you see listed on the screen. Cornerstone Family Healthcare, Ellenville Regional Hospital, Family of New Paltz, Institute for Family Health, again, New Paltz PD, New Paltz Rescue, New Paltz Youth Program, New NP Safe, which is on campus through their wellness efforts, and Campus Police Department, and also Ulster Prevention Council. As I mentioned, the provision of Narcan training and kits is essential to the success of our efforts. And so we provide different types of trainings in person, whether that's been through the open air markets or Jackie Cirillo and her team on campus providing in-person trainings there. We partner with Elting Memorial Library as well as a number of other locations in the community. And we have one coming up Tuesday, February 25th at Elting in the Steinberg Room. Tuesday, February 25th, again, 6 to 7 p.m. Thank you again for taking the time to watch today's video and also for helping us spread the word about the efforts being done by the New Paltz Opioid Overdose Prevention and Response Team, including our upcoming free community Narcan training happening Tuesday, February 25th in the Steinberg Room at Elting Library, 93 Main Street, from 6 to 7 p.m. I hope that I'll see some of you there. And also, if you have any additional questions, please feel free to reach out to me. using the contact information in the description below. Take good care, everyone.